Great. Well, I'll welcome everyone quickly and then we'll jump right in. We are very excited to present this topic today on how top dental practices turn leaking production into recovered revenue. So, a very important topic for everyone. We want to make sure that we are running not only the dental practice as a center of care, but also as a thriving business that can provide care for many years into the future, and that all the patients are getting the treatment that they need in the form of the production you provide. So that is our topic for today, and I'm going to turn it over to Shayna to give a little bit more introduction here.
Thank you, Neil. Welcome, everyone. A few familiar names as far as attendees. My name's Shayna. I'm the manager of client success here at ThriveCloud. I've been in the dental industry for almost 20 years, started with training dentists on CAD/CAM, cone beam, digital workflows from a clinical standpoint, moved into the software space about 7 years ago. I'm really passionate about that because I believe you it's really the direction of where everything's going in the industry and just the efficiency that especially cloud-based software brings to the market. Prior to accepting the role here at ThriveCloud, I was director of operations for a DSO out in Arizona, which really I'm excited to go through this because I had firsthand experience of these little tiny production leaks that really add up to have a big impact on the practice. And Neil, I'll let you introduce yourself because I won't be able to do you justice.
Sure, no worries. I am Neil Kotari, the president of Thrive Cloud, and I've been also in the space for many years. I'll leave it with the fact that I'm very excited to work with dental practices, and I've loved to help them understand how to implement technology to achieve all of their wonderful goals, and then also learn a lot from the practices that I work with. So that's a little bit about me. So back to you, Shayna.
All right. Well, let's go ahead and dive into the agenda for today and what we plan to cover. Of course, the title, where production leaks occur. And then what we're going to go over is what top practices, what we're seeing those best practices are to recover those lost opportunities. And then that technology aspect. There's so many softwares out there today. How can technology help you close those gaps and really bring that production to those monthly goals you want to hit? I did mention earlier, questions, please, anything pop up, go ahead and drop it in the chat. We will do a open Q&A at the end, but if there is something just you want us to cover or you think it might be coming or any questions, please feel free to use that chat functionality.
Great. Thanks for that overview. And we're going to kick it off with our first aspect of this topic, where production leakages occur. So Shayna, you can kind of talk about this, and especially with your experience that you bring, having worked inside and outside the dental practice, I think it'll be wonderful to get your insight.
Yeah, thank you. I think that, there can be a strong disconnect between what's happening in the front office and what happens in the back. And really, a big part of this is the handoff. So research shows you have to hear something 7 times before it sticks. So cracked tooth, cracked tooth, cracked tooth, it's going to get worse. So with those handoffs, it's super important that we're educating the patients, but also our team on how to have good communication when it comes to working with the patient. So first example that we'll kind of dive into here is someone requests an appointment or they cancel last minute. Do we have them rebooked? Why did they cancel? Are we educating them enough on the value of the dental treatment that's needed and why they need it? Are you just diagnosing, but maybe not scheduling? You think they're saying yes, or they are saying yes, but are they actually making it on the schedule and committing to the treatment? Another leak that we find is completing a procedure. A lot of times we see the staff, walking them out with you've got an insurance balance estimate, but maybe not collecting anything as opposed to collecting and crediting the patient as needed. So really, are you getting paid for that procedure? And then the patient leaves. Are you getting them rebooked? As soon as that patient walks out the door, I always worked with the team on this. You're up against life, you're up against school, you're up against family, you're up against all these other schedules and commitments. And as soon as that patient leaves, if they don't have another appointment, it's even that much harder to get them back. So this is really these handoffs, if they are smooth and simple, they'll just help with these tiny little increases to your production.
That was really, really well explained. I like the analogy of seeing dentistry as a relay race. So each of these points that Sheena touched on, they're really either a baton pass or a baton drop. And when that baton drops, that's where the leakage is occurring. And so today we really want to get into those baton drops and turn them into handoffs instead, successful handoffs. So we'll go into that first area that Sheena mentioned,
Yeah,
and she'll talk more about that.
that's a good analogy. I've not thought of it like that. You don't have that perfect little pass. Um, so chair time that expires. When we talk about this, this is that patient that's not just running late, they're just no showing, or that patient that's calling 10 minutes before their appointment because they forgot, and now you're sitting with an open hour of hygiene. Do you have a short notice list? Different names for that in different softwares, but how are we getting ahead of the appointments to confirm so that our schedule doesn't fall apart the day of? Um, Again, the self-scheduling, Neil, I don't know if you know the most recent statistic, but most engagement these days is via phone. So whether it is, when I say phone, checking their emails over the phone, they want to text. I'm a mom. I want to schedule my kids' appointments online at night when I'm done working. They don't have an online scheduling, so it just gets put off. So really it's that convenience for the patient to make sure it's as easy as possible to get on the schedule. Holes in hygiene, very easy to be booked 3, 4, 6 months out. And then again, day of, day before, just the schedule falls apart. And that was, production that you were planning on. On top of that, you're still on the hook to pay your hygienist. Um, and that kind of ties in as well to the openings found too late. I've got a patient on the schedule. They haven't confirmed. I haven't heard from them. Are they coming? How proactive am I being up front with getting them, one, confirmed, but also that value of why it's important to show up for my appointment? Um, and then those patients that just cancel, to me, that is, they're not seeing the value of the treatment proposed, or presented rather. And so, what do we need to do different to make sure, again, they're seeing that value? We use our mouth to eat, we use our mouth to love. This is so important. Oral health is tied to everything else in our body. So, do we need to educate the patients better from the back to the front? And really, all these little holes can add up. In the example here, just 2 hours a day at $300 an hour, that's 125,000 a year in unused capacity. So it's really, are we reacting fast enough to recover those openings before it's just sitting there as an open chair time?
Yeah, very, 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 very important to protect the schedule and make sure it doesn't expire or that chair time. And I want to make sure everyone's in the right frame of mind because we're going to come back to this framework again and again. We're starting here with chair time or scheduling. We're going to move into diagnosis, and that's another, it could be a baton drop. And then we talk about converting that production into cash, and then finally making sure patients are returning. So these are like kind of the four pillars, but also four places where we see those leakages. So we're going to move on to that next, the second of those four, which is diagnosis.
I hear this a lot. I actually just heard it on a call on Monday that they're saying yes to the treatment, but they're not scheduling it. So what's going on there? And that kind of goes back to what I was saying previously is, are they just saying yes to get out the door? Do they truly understand the treatment that they need and why they need it? Studies also show that if you can get the patients to ask questions, the likelihood of them saying yes significantly increases. And really, that's part of leads into the patient being confused. Allow them to ask questions, have that awkward silence, let them be the first person to talk. Sometimes we get in the dental space and we're so used to talking about tooth numbers and MODs that you kind of forget that that patient has no idea what you're talking about. And then insurance, one thing that I ran into, especially end of year, Neil, was oh well, it's they're maxed out, so I'm not gonna I'm not gonna present it to them, or I'm gonna tell them we'll schedule in January when it starts back over. One, you're relying on that insurance plan not changing, but two, you're just delaying that treatment, and we all know what happens when a patient delays that treatment, it just gets worse. So really kind of taking the insurance out of the picture. I like to refer to insurance as a coupon when I explain to my patients because they don't understand um, medical insurance versus dental insurance. They just, it's an opportunity again to educate the patient. I'll think about it, right? That's the same going back into their not seeing the value. Um, you, you can see that patient that comes in with that fancy handbag but doesn't want to do take care of their cracked tooth. So it's not that they don't have the money to do it, it's that they just aren't convinced that they need to do it. Um, and again, valuing unscheduled treatment, an implant over a crown, that type of thing, are we getting those big cases in the door? And are we treating those big cases the way we need to treat them? Um, we just have to, there's so much opportunity out there, and it's really about prioritizing what's coming through the door and working again with the team so that they're hearing it from the front and the back with that baton pass. So, kind of this leads into what I was talking about before, the claim delay, kind of where do we get stuck? Um, the claim. Good old insurance, and you'll I forgot to do the attachment. I forgot to add clinical notes to the claim. Maybe I didn't get the patient verified and now I'm stuck going back and forth. I presented the wrong treatment plan, their insurance changed. Um, Fee for service. There's all sorts of spots where you can get stuck with those production goals. Um, that patient portion being uncollected, I like to work with the teams to always collect something. Um, Even the strategy of, if I'm scheduling a crown, let's just get a small deposit. I want to get some skin in the game from the patients. One, to hold their appointment accountable, but also, again, I need to be on top of my collections just as much as I need to be on top of my production. Um, One thing I like to point out here is that inconvenient payment. This is just like scheduling and having online scheduling. So again, if you get that text to pay, I mean, I've paid personally myself, I've paid a bill in a parking lot after dropping the kids off at school. Making it easy to pay is going to help with that AR.
Yeah, great point. And this is the final kind of breaking point, but a very, very important one because studies also show that most dental office production can be sourced back to the regular care and the regular visits that patients have, twice a year. So if this last aspect is breaking down and leaking, it really is a slow erosion to your practice.
Yeah, and oftentimes, you've got your daily production goals, weekly, whatever you have set up with your office. The treatment is there. It's just a matter of getting them on the schedule and working with that team so you've got that perfect relay race. And that's where it slowly erodes. That overdue recare, I'm guilty. Here I am in the dental space. My dentist let me walk out without scheduling. I'm overdue. Um, Again, canceled hygiene not recovered, not just, oh, I need to cancel. Okay, no problem. Was it the day or was it the time? How much notice are they giving you? Oh, Tuesdays aren't a good day. Let's look at Thursday. What's a good day? So that we're not hanging up that phone call or having that face-to-face interaction and not having them back on a schedule with another committed date. I also see inactive patients go really far deep, and there's layers as far as what an office considers, their current active patients. I've 18 months, 2 years. I've kind of seen the whole gamut there. But those inactive patients, are you making it easy for them to get back on that schedule? But are you contacting them? We don't just want to let them go to the wayside. We want to make sure that we're still trying to engage them. And maybe that's a promotion. I just got one myself for a Botox, bring a friend, and you get $20 credit. Maybe that's going to draw in patients that have kind of gone off the schedule, fallen into that inactive category. Maybe I need to try a different approach to get them back. Um, and weak engagement after the visit. Great example here, actually, one of our team members, she was looking to do some clear aligners and she had gone to, I think, 3 or 4 different ortho offices, kind of getting quotes, seeing what her options were. And she ended up going with the office that called her back that same day after she visited. So a little phone call just to check in. Whether it's treatment pending or treatment completed, like, hey, this is Shayna. Just want to make sure you're feeling better after that root canal. I know we still need to take care of XYZ. Just those little tiny things can really add up and build that relationship with that patient to keep them engaged and on the schedule. And the hygiene, really, that's, you get 3 hygiene appointments on the calendar, you keep them or reschedule them, use the short call list, can add up to $20,000 a year. It's a nice holiday party. So, um,
And that is before, I think this is really important. That's the tip, literally the tip of the iceberg, because the iceberg is actually the treatment that comes through those hygiene visits, the high value treatment, the referrals that can come from happy patients who keep getting seen by your office, and the reviews that they'll leave for the service you provide, which will inevitably grow the practice. So the 20K per year is just the very tip of the iceberg. You're talking about the majority of your production is coming from these hygiene visits. One more thing I want to note here is going back to that example Shayna mentioned about the person following up. It's really, really important to step back and make sure, what kind of team have I assembled and trained? Whether I'm the practice owner, whether I'm the practice administrator or office manager, what kind of team have I assembled? Have I assembled a check the box, bare minimum, you know, clock in, clock out team? Or have I assembled and trained a team that is highly engaged and highly motivated and maybe even incentivized to take that extra step? Because that's going to be the difference between a multi-million-dollar producing office versus a struggling practice, right? That mindset of your entire team. Then, of course, like today, we're talking about all the different protocols and technology you can use, but it has to start with that mindset. Are we highly engaged, or are we just check the box, bare minimum, clock in, clock out? So with that note, we're going to move into, we talked a lot about leaks there, and I think it's very important to identify the problem and how big the problem is. Now we're going to talk a little bit about techniques of how top practices plug the leaks. And this is coming from actual practices that we have worked with and different studies that have been done on the high performing teams. So again, a little bit of mindset here, but also very clear tactics that everyone should be implementing. And the first one is, you got a leak. There's going to be leaks, right? If you're a homeowner, every time there's a rainstorm, every time there's some weather coming through, there's a likelihood or a possibility at least of a leak. So leaks are not the problem. It's like, do we have a next action to that leak or that potential leak? So in this area here, what we really want to emphasize is that, number one, there should be a task owner for each of these 4 aspects that we just discussed: scheduling, scheduling leaks, the diagnosis leaks that occur after that, and then the collection, and finally the recare. So there should be a task owner, and that task owner, whoever they may be, should identify some of the things we're going to mention here and then act on them. So an example here is same day openings. So if you do have same day openings, what is that outreach that's going to be done? And we'll give some examples of what can be done, but that's going to vary widely by office to office of what do you do when you do have a same day opening. Do we just start scrambling and panicking, or do we have a systemized protocol? Another one is unscheduled treatment. That's going to happen. No matter how hard you try and all the things you implement, you will have unscheduled treatment. How is that being prioritized exactly? And how is that being assigned out to your team? Next one is missing claim items, is very common. So are we flagging and resolving that before submitting? Because a lot of times we catch it after submitting, and then it's just like, chasing it down and phone tag and all these things, and then trying to resubmit. So who's doing that? And finally, overdue recare, which we just touched on. Is that in a day? Do you have a daily call and text queue? And Shayna gave that a great example of the person following up. Do we have someone doing that for recare on a daily basis or at least a weekly basis, so that that's not an ongoing leak? So these are next action examples. But again, recovery does improve when you have an owner, like I said, an urgency to it, and a very clear next step. And another thing that top practices we've seen do is that they really act quickly. They protect the moment before it goes cold. It's nice to dig in and try to get those inactive patients back in, and you should be doing that. But the reality is, the longer the action waits, the less likely you have recovery of whatever that opportunity is. So here are some examples of expiration points. So open chair time is the most obvious one. That's going to expire the same day. You can't do anything about that tomorrow, right? So that open chair time, there's a clear deadline on that. It's today or earlier. And ideally earlier, you're catching that, and we'll give you some tips on how. But at least, that day, and cancellations will happen. We got to work very quickly on that. The next one is treatment interest. We talked about all the reasons that treatment doesn't get accepted, or it kind of, withers away. So that quickly starts fading, that interest, after the patient leaves. When the patient's in front of the doctor, that's when they're most attentive. They're listening the closest. They're very captive. Literally, they're in the operatory, in the chair. They can't really get up and leave. They're very captive. As soon as they leave that chair, it starts to fade. Claims and balances. We all know this. Doesn't it kind of goes without saying, they get harder as they age. And finally, recare patients, the more, the less you're following up, and the longer they wait to come back in, they may have found another dentist. They may have, changed their mind about coming to you. So we got to really be on top of that. So the best systems, if we do have them, they don't just store information. It's easy to see, okay, what are the claims looking like? Who are the recare patients? The best systems will help you actually shorten the time between seeing something and acting on it. Another technique is, top practices are really closing the loop before it moves downstream. So going back to that urgency, right? Resolving the next risk when it's created, not days later. So here are some examples of that. You want to act before the handoff. We talked about the baton pass and the relay race. You want to make sure you have a very firm baton pass. So cancellation, if we have a cancellation, there's two options there. You can say, okay, thank you, Sally, for letting us know. We appreciate the notice. Let's get you back in one day, and we'll follow up on that. Or, hey, Sally, thanks for letting us know. Let's figure out when we can get you back in. We don't want to pay. I know you don't want to play phone tag, Sally. I don't want to play. No one wants to play phone tag. Let's get you back on the schedule. And of course, if something comes up, you can let us know again, but let's get you back on. So before it goes downstream and becomes someone else's problem, or maybe even your problem a week later or a month later, let's get that rescheduled. Diagnosis, let's make sure that there's some sort of even tentative decision and a follow-up date. Hey, hi, Sally, I'm going to follow up with you about this. I know you need some time to think, but I'm going to call you this Friday. What's the best time to reach you on Friday to talk more about this? Make that kind of a determination before they leave the office. Checkout, Shayna talked about this, collecting some sort of portion, or at least setting up a payment plan if they need that. And finally, as they're walking out, make sure the recare is booked. That's a complete no-no. If they're walking out without their next recare booked, they're going to make some excuses. They're going to say, I got to look at my schedule. I'm not sure. 6 months is a long time from now. Oh, don't worry. Let's get you on the schedule. Let's get you the best time and day that you think as of now. If something comes up, we'll be able to move that around, but let's at least get you on the schedule. So close the loop before it moves downstream. And then another technique here, which goes back to what I said about systems, is we should have clear protocols, rules that match the right action to the opportunity. So we don't want to panic. We don't want to scramble. We don't want to just have one person doing it another one way, and the new person comes and they do it a different way. Right? So examples here, if you do have a same day opening, what do? What is our protocol, right? How do we figure out how to fill that same day opening? So I'll give examples later of things you can do in the software, but how do we figure out who are those five best fit patients within 15 minutes of learning of the opening, right? How do we really make sure? Another example here is treatment. Let's say treatment over $1,000, treatment plan. Like I said earlier, assign follow-up before checkout. Who's on this and when are we going to follow up? Maybe 1 week after and 2 weeks after. There's a point of where you're making too many attempts, but at least 1 week and 2 week is not a bad idea. And then another example, I'll just skip to the bottom here, is a balance. So if you have a balance due and you have to have a threshold, so your team should know what is that threshold. If there's a certain balance, let's say it's over $200 or 60 days, we must require payment at the next interaction with that patient. For example, right? There could be other, ways you follow up on that, but at least at the next interaction, let's make sure we take care of that. So clear thresholds, what they do here is they're turning these missed opportunities into consistency, right? We want everyone knowing when to act and how to act. So that's the pre-decision that we're talking about here. And kind of lastly here in what top practices are doing generally, they're using technology to make that next step very, very obvious. We want to make it dumb simple. The goal is really not to add a bunch more expensive tools and shiny objects to our computers. We want to really have fewer missed next steps. So again, making it dumb simple, having faster patient follow-up. How can we do this? How can we leverage technology to follow up more and more regularly than we otherwise could, right? We want to see that treatment that's there sitting unscheduled very quickly and act on it quickly. And lastly on this list at least is less manual hunting. So we don't want to have to dig through a bunch of reports. And by the time we figure something out, it's way late, right? We're a month or two behind of when we could have acted. So your practice management system should really be this connected workflow that allows you to move these opportunities forward before it gets too late, before that expiration. So I'm going to pause there and see if Shayna has any other thoughts on some of these strategies before we dive into technology, which is one of my favorite topics, and how we can leverage technology. But anything else to add, Shayna?
I think, we were talking about letting them walk out the door. A lot of times up front, they're like, oh, I need to talk to my spouse or my partner, and just saying, let's get them on the phone right now. Offering to do that even in real time is a nice strategy, just so they're not giving you all those excuses. But yeah, no, everything else
Yeah,
of what you said. Let's get
yeah,
into the tech.
great. So making that transition. So we want to have that next step. We want to have an owner. We want to have urgency, but let's leverage technology. So for some of and maybe even use ThriveCloud. For those who don't, just a quick kind of what is ThriveCloud? It's an all-in-one AI powered cloud solution for your practice management. And it's something that does everything, right? So we don't want to be just yet another add-on tool. We want to be the core software. And whether you use ThriveCloud or you use some other system, it should be this type of system, because this type of system, the more you can minimize and streamline all your different tools, the better and more likely your team is going to work on getting all these things done that we just talked about. So try to go for a system like this one. I'm going to show some examples in our system because that's what I know best. But whatever system you do have, try to see if some of these can be implemented. These strategies can be implemented. So number one, we talked about chair time. So we're going to focus first on chair time recovery. And the first thing you really want to have in your system is visibility. So do I have the ability to see what my scheduled production looks like for whether it's today, but in my opinion, today is too late. I would want to look at it, and you can in this system look at it well in advance. So do I have clear goals for my team, and can I see what that scheduled production looks like? Can I even see my unscheduled time specifically? What are we working with here? Do we have an hour open tomorrow? Do we have 2 hours open? How much do we need to act on this, right? And then even on the schedule itself, showing how we are to goal, and really being able to work on that, and making sure everyone can see it. So that's first thing, visibility on chair time recovery. Next, you should have some sort of automated texting solution to prevent holes. So as they say, the best cure is prevention. An ounce of prevention is worth a pound of cure, or something to that effect. So we want some prevention here, and that really is automated texting. Do we have a save the date going out right away as they're walking out the door? Do we have a, because as I said earlier, the patient's thinking 6 months from now, I don't know where I'm going to be 6 months from now, right? So do we have a system where a month before that 6 month appointment or a few weeks before, you're getting it back on their radar so they don't schedule a vacation on top of the appointment and they have to call and cancel, right? So initial and then confirmation close to the appointment, get that confirmation so your team knows who to follow up with. And then a final visit reminder, people forget the day of, right? Life gets busy. So are we doing that? Another nice thing to have is give some automated feedback to your patients. So when they do confirm, are you sending back a text saying, we got it. We're really excited to see you, right? Getting that. So they're not just sending it out into the ether and not even knowing whether you got it or not, right? So send that confirmation response. And finally, this could be controversial, but it's worth considering having a feature where the patient, if they really do need to cancel, maybe you want to try making it a little bit easier just so you know more in advance. If they're not going to show up anyways, I'd rather know 3 days before than day of, right? So if you make it a little bit easier for them to cancel, and maybe there are some protocols that you inform the patient about regarding that, but you make it easier, then that just opens up the time earlier than just panicking last minute. So this is the prevention aspect, and this is just an example of some of the texts that should be going out. Hey, thanks for scheduling. Please confirm. Here are your forms, making sure they get their forms done and allowing them to confirm. The other thing in chair time recovery is we may have some holes, right? Everyone has these things that occur with cancellations. So do I have the ability to really look at some lists and fill those holes quickly? Can I mass text? Can I figure out, okay, out of, like I said earlier, the top 5 patients who are best fit to fill that hole, can I identify them and text them quickly? Of course, you may also want to follow up with a phone call, but let's at least get something out there so that we get a response quicker. And then when they do respond to my text to come in same day, can I see that very quickly in the same system and say, okay, great, she replied, she wants to come in, I'm going to get her booked, and we recovered that very, very valuable time that we could have lost. So that's how to plug the holes quickly. And then finally, for chair time recovery is we talked about self-service. So can we enable patient self-service? Because you do have those patients. You'll never know who they are, and you may be missing them, but there are those moms and dads who are late at night. They got all the stuff done. They put the kids to sleep, and now they have a breather to actually schedule a dental visit, and everyone's closed. So what are they going to do? They're going to go for the office that has online scheduling. And this doesn't mean you open up your whole book and your calendar to everyone for anything. You can keep it limited to things like new patient appointments, recare, and emergencies. And those are fairly easy to manage, and you can really customize it if you have a good system like this. So that is like the last thing for chair time recovery. I'm going to take a pause there and see if Shayna has anything to add, but those are some really good techniques with technology.
I think you nailed it.
Great. Okay, if you have nothing, I will move on. The next problem we talked about was diagnosis, right? We'll call it here diagnosis decay. So after you do the diagnosis, it starts to decay, it starts to fade in their mind. So the best thing we can do is while they're in the chair, of course, we're going to talk to them. Of course, we're going to explain the best of our abilities, and the clinician will do that. The dentist will do that. Even the hygienist may do it. And that's a great thing, is having each other emphasize and reinforce what the other said if you have multiple clinicians and assistants. But you can leverage technology. So one way a lot of you may know about already is the AI revolution that has come to diagnosis, and that if your system allows for you to use AI to really identify some of the treatment required, and you show that to your patient, seeing is believing, right? Seeing is believing. I think there is some skepticism out there among dental patients when they go, oh man, here we go again. My doctor's going to find a million things I got to get done, and I'm going to have to say no. It's going to be awkward. Let's remove ourselves from that for a moment and let AI do the talking, right? Well, here's AI saying where the problems are and what I want to, focus on. And of course, you're going to have other things that you recommend, but this is a good support for you. Another support is patient education, having the ability to, if there's a a very common procedure you're diagnosing, let them watch, again, seeing is believing, let them watch a video on it in share, or let them take home the video via texting. Can your software do that, right? We want to make sure your software is able to provide videos and education and all these things. So that's convincing. The other thing is let's get it signed right away. Let's do an e-sign. Let's show a very good treatment plan that's very visual and clear, and let's get them signed, right? And in this system, they'll get a copy of that instantly and they can sign, right there. Now, you do all that, but you still may have some follow-up to do. And I talked about earlier having some protocols, 1 week, 2 week, etc. Does your system have a place where you can go to see all the treatment that has been diagnosed, even if you didn't really do a formal treatment plan, but what was actually, diagnosed in the dental chart? And can we pick and choose and mass text people that are on there about moving forward on that treatment, that important treatment, right? And can we really whittle that down to a nice list, focusing on high value, high priority first, and then get to the other stuff? And of course, phone calls would be a good idea, but you can also lead with texting. So that's following up, making sure your system allows for that very easily. So that is the second leakage that we want to plug. The third one is production to cash, right? We talked about all the great work you guys are doing, but it's not converting to cash sometimes and collecting. So if you do have a significant or even, minority insurance base, it really does start with verification. It's maybe counterintuitive, but some of you are very clear on this. Verification is a must. So does your system allow you to identify who needs to be verified on the schedule? Does it give you an alert? And does it show it very visually so your team can follow up and do some real-time eligibility check right there? Not all insurance carriers play great with verification, no matter what system you have, but there can be some that you can verify electronically and then some that you have to follow up. But at least can we see that? Are we on top of that? And then when you do have insurance and you're on the other side of the equation and you've done the treatment, can we do proper cleanup, tracking, and follow-up? So do we have some stats that make it very clear that I can then dive into? For example, unbilled insurance. A lot of times the claims aren't even getting created, right? If you're not creating a claim, what are we doing on the insurance side? So can we see what needs a claim at a high level? And then when we do create those claims, can we do a quality check? Can we see what issues need to be corrected? Does your system do that electronically? Oh, there's a missing narrative. There's a missing X-ray. There's whatever it is, right? There's missing patient information that you're going to get rejected here. Let's do a quality check and clean up before we submit, as we talked about. And then finally, on the patient side, so we talked insurance. Patient side, can we collect balances quickly? We do collect patient portion as patients walk out. However, especially with those insurance patients, we need to wait until insurance reimburses, and then we know what the remaining portion is. At that point, you're going to have some balances. Can we do text and email, right? I'm okay with you guys sending statements, physical statements. I love multi-channel, so I don't say don't send a statement physically, but can we make it easy? The inconvenient payment we talked about, can we make it convenient? Text and email is the most convenient, and more so text, being able to text to pay. So here's an example. Make sure your system allows you to send out a text like this where it tells them what the balance is, how to make a payment with a click, and then how to see their actual statement, what they're paying for. Let's make sure we're providing this, and you're going to see a transformation of your collections and your AR. Lastly, we were moving here now to the ReCare engine. We want to make sure our ReCare engine is humming along and full, all cylinders thriving there. So can we have visibility on what our hygiene looks like? So what do we have goals for scheduled hygiene? Do we know what unscheduled ReCare looks like from the perspective of, last three years or 6 months, whatever time period you want to look back? How are we doing on unscheduled ReCare? And so once we have that visibility, we want to pair that with some automation. And the automation is really just those reminders, right? And when we're saying reminders, Not just, hey, you got to come in. It's been a while. We miss you. But here's a way to schedule yourself. If you're too busy to call us, no worries. Click this link and schedule. So having these automated reminders going out, but then also the ability to for them to schedule. And you might want to sweeten that a little bit with a video of why hygiene care is important for your health. Does your system allow for all these things? Because when you combine all these things, the texting, the online scheduling, and the video, you're putting best efforts. No one can blame you, after you've done all that, right? You've done a lot, and then you can do some phone calls, and if they're still not responsive. The other thing on protecting your patient base, you've done the automation, but let's also look. Automation's not everything. We got to go look at our list and make sure our lists are not super long of who hasn't come in. And if they are super long, let's do a bulk text and do some sort of customized bulk text to get them in the door. So those are some of the strategies from a technological standpoint. I could talk another couple hours, and I will not do that to you today. But there are so many strategies that technology can unlock for you to plug all these production leakages. Now, you may be thinking, man, either my system's amazing, it does all that, or I'm going to look into it. I don't know if it does all that, but I'm going to look into it. Or you kind of know, hey, you know what? I need an upgrade. I need an upgrade in technology, but I'm scared, right? This is what people call change management. And change management is really getting your team to move with you, get to the promised land with you from a technological standpoint. So what we want to do there, when we think about change management, if we do need a tech upgrade to plug these leaks, then there's four things, right? So you want to really, on your staff, you want to recruit some champions early on before you even start looking at upgrading, or when you very early start looking. Get some champions on your team that realize what the issue is. As a leader, you have to really message on that, right? Like, what is the problem? Why do we need to upgrade? And involve them in those workflow decisions. When you get into the process, when you found your solution, make sure you're testing that converted data. And so, because data is everything, and we want to make sure data is good when we make this transition of a tech upgrade. And then, are we training each and every role on their specific tasks before we go live? And finally, after you go live on a new system, if you want to do a tech upgrade to plug these production leakages, are we doing daily issue resolution huddles? So you're going to have issues. Everyone's going to have issues, no matter what system you go to. But can we really triage that? And really, the first 2 weeks is the critical period. After that, you're usually in a good spot, and it's just kind of little things after that. So can we triage? And the vendor that you work with, are they helping you do all four of these things? Because I know we do. So is your vendor that you want to upgrade to, are they helping you do these four things and making sure you're able to manage that change? So that's just a little plug about change management if you do feel like you need a tech upgrade. And with that, I'm going to open it up for Q&A. I hope that some of what we shared today sparked, some thinking there, and you may have some questions, and we love questions. So we'll stop here and allow for Q&A. So do we have anything, Shayna, that you may have seen from a question perspective?
Give me a moment. There was one. One moment. Too many screens. Kelsey, did you see that one that came in? I apologize. I clicked out of my chat here. There we go. All right.
And as we're getting that first question pulled up, this is a great time to, if you hadn't asked something and you want to hear more, then put that into the chat.
Yeah, one that I've got is, how do we tell whether recurring leak is a workflow issue, a staff issue, or a technology issue? Do you have any best practices you can recommend there?
So workflow, staff, or technology, what's causing the leak?
Where's the
So
leak? Yeah.
yeah, and that's a great question. I think what I would recommend is really, measuring, um, really looking at if there's a missed opportunity you're seeing. Let's say it's recare. Track that from start to finish and figure out, where what is causing that. So if there's no defined next step when it comes to like recare follow-up, you have a process issue, right? You have a workflow issue. If you do have a defined step that you've trained your team on of how to follow up on recare, then and they're not implementing it, then it's accountability, it's staff, right? We got to retrain. And then if you feel like you've done the process, you've trained the team, they're trying, but they're still struggling and information's everywhere. You got to go over here for a report. You got to go over to a different system for text messaging. You got to do another thing for, the analytics, other analytics regarding recare. Then you have a technology problem, right? And that's very common where you have scattered technology, disjointed technology, fragmentation. So that's a technology issue. So really take these leaks and look at it from beginning to end and see where it's breaking down. Is it the workflow that you haven't defined? Is it a team that's not implementing, or is it technology that's just making it harder than it has to be to do the work that needs to be done?
And there was a question on how to send a mass text. It depends on the software, what you're using. I will follow up with that question at the end of the webinar.
Great. Yeah, and mass texting, I love that. You obviously want to be careful and not overdo it, but I think having that as a healthy step in your process, whether it's you're trying to fill a chair that's open, or you're trying to do the recare follow up, or the bulk billing, mass texting is wonderful and can really multiply your results. So yeah, we will follow up with that in more detail if it's a person that's using our system. So what other questions? Any other questions? And again, you still have a chance to put something in the chat. We'll give
Another
it.
one that I had privately was what do we recommend owners to review each week to catch leaks before they show up? So what can we do to be proactive? I'm a
Yeah, and
big
that's
fan of huddles.
yeah, huddles are amazing. If you're not doing huddle, there's a reason why it's so popular. It's not one random office came up with a huddle and everyone started doing it. There's a reason why it's very popular. I think what this question is getting at is what's called leading indicators. You have something called leading indicators and lagging indicators. Lagging means the problem already occurred, or whatever could have happened already happened, and now I'm learning about it after the fact. That's a lagging indicator. We love leading indicators, so we know whether we're on track to achieve the goal or not. So some of those would be, like I showed earlier, unused chair hours would be one, if you can see that in your system, and then work on them. Unscheduled treatment that's aging, quickly getting old, and we want to jump on it. Any claims that we see some delays developing, and the recare stuff, the overdue, we see that bubbling up a little bit more than we'd like. Those are all leading indicators that you're going to feel the pain later. So might as well let's act on it now. So these are some of the types of metrics that we want to be looking at. And if you have, like we do in our system, an analytics portion that really shows it to you clearly, then you're going to be in a better position. Great. So those are some great questions. If there are any other ones, we will look at them and then be able to answer. I just want to wrap up here with a couple more things. So we would love to do for you a free, what we call a production leak review. This is going to be just a discussion with your practice of critical leakage points. So the four that I want everyone to remember again are chair time, diagnosis, production to cash, and patient base erosion. So these are the four areas where we would love to discuss where you're seeing problems, where's your holdup or your team's holdup, where is it, are we falling short, and then what can we do about that? So that's a production leak review, and that's going to be just free, and we'll you can schedule that. We're going to drop a link in the chat, and we'll include it in our post webinar email. But the link that's going to be in the chat is you just go to that link, put in your information on the right side, and you submit that form. It'll say demo form, but essentially we'll do this production leak review, and then we'll schedule that at your convenience. You can also reach out to us. There's a phone number there at the bottom. 800-916-2230, option one, and the email there, sales@mythrivecloud.com. And lastly, if you do think that the solution we kind of demoed today a little bit in the third portion, if you're interested in learning more about that, we do have a great offer for just for those who have attended this webinar. If you do schedule a demo and you're really legitimately looking for a technology upgrade, then we'll just for your time, we'll give you $100 gift card. And then if you do feel like ThriveCloud is a good solution to help you plug these production leakages, we will provide that first month free and a free X-ray conversion to help you make that transition. So very good offer here, exclusive for the webinar attendees, and it's close to $1,500 that you would otherwise be paying for. So that's something to get you a little bit motivated here. So, but I think ultimately, you know, if it's a system you're on and you want to stay on it but really look at those areas and those techniques, this webinar was recorded, so we will provide it to you, and you can go back and kind of look at those techniques that I covered and see if your system can do that. Otherwise, I recommend at least looking for a system that can do those things to help you plug the leaks. So with that, I'll turn it back to Shayna if she has any closing remarks. But I do want to thank you for your time on this webinar.
Yeah, no, thank you, Neil. There was one question. They are a ThriveCloud user currently, so I will open a ticket on your behalf so we can get you some training on how to do those mass texts. But yeah, really, we want to help you thrive and appreciate your time being here today. And anything, feel free. We'll include our contact info as well in the follow-up email if you've got any additional questions.
Great. Well, thank you again, and we look forward to the next topic to help your practice thrive and continue this journey together with all of you and in your goals. Thank you, everyone, for attending.
Thank
Have
you.
a nice rest of the day. Bye.